This is News Tonight.
Good evening, I'm Jill Newbrunner. Here are tonight's top stories. Battling the COVID-19 cluster at Tan Tock Seng Hospital. All hospitals asked to defer non-urgent treatment in order to conserve resources and ensure patient care is not disrupted. At the same time, polyclinics introduce entry restrictions as 8 more cases are tied to the TTSH cluster. 35 people are now linked to it. And long queues seen at coronavirus screening centres as public testing begins for possible exposure to TTSH infections. Also tonight, India's oxygen crisis in focus. The country's top court orders the government to ensure enough supply in Delhi by midnight. All hospitals have been asked to defer non-urgent treatment as Singapore battles the COVID-19 cluster at Tan Tock Seng Hospital. The Health Ministry says that's to conserve resources, and that includes reserving hospital beds for any potential rise in coronavirus cases. The TTSH cluster now has 35 cases after 8 were added today, making it the country's largest active cluster. The ministry says it worked out the measures with all private and public hospitals to ensure that patient care is not disrupted. MOH has also given the assurance that no hospital will deny healthcare to patients who need it. To keep other hospitals safe, the ministry says stricter entry will be imposed on those who had been to TTSH. Some inpatients may be asked to defer their visits. Authorities are also urging people to only visit the emergency room for life-threatening situations, and these include persistent chest pain or serious injuries. Longer wait times are also to be expected as other hospitals help to absorb Tan Tock Seng Hospital's A&E patients. Meanwhile, more medical staff have been deployed to Tan Tock Seng Hospital, which stopped admitting new inpatient cases from Sunday. Ambulances will divert to other hospitals to balance the patient load.